Hi everyone. Today we are going to do an educational presentation on correct and safe bed mobility for hospitalized or confined patients. Bed mobility. If one person is injured or ill, they may not be able to move around normally due to weakness, decreased range of motion, or pain. Bed mobility is the ability of the patient to perform specific motions while in bed. Normally, physical therapist is assessing the patient about the bed mobility along with training the strategies and exercises to improve bed mobility. In this presentation is explain about the strategies and exercises to improve bed mobility in hospitalized or confined patients. Why bed mobility is important. Human bodies are meant to move. If patients are not able to move well in bed, their body may suffer from disuse, atrophy, or a wasting away of muscular strength. This can lead to increased difficulty with mobility. If patients are not being able to move in bed, can also lead to pressure ulcers, especially if they are severely deconditioned and remain in one position for a long period of time. Their skin may start to break down, leading to painful wounds that need specialized care to heal. Being able to move properly in bed can help prevent pressure ulcers. Why are we learning bed mobility? For the safety of the patient from fall and further injury. There is an increased risk of injury for the caregiver while assisting patients with limited strength and mobility. For the safety of the caregiver and the individual who needs mobility assistance, here referred to as the patient, it is important that good body mechanics and safety are always maintained. Different motions in bed mobility. These may include scooting up or down, scooting sideways, rolling over, twisting and reaching, lifting your hips, as in bridging, moving from sitting to lying down in bed, moving from lying down to sitting up in bed. How to prepare for bed mobility. Before starting any exercise for the bed mobility, discuss with the healthcare provider to ensure that exercise is safe for the patient to do or not. Seeking help from the physiotherapist can ensure that we are doing the right exercises for the patient perform the bed mobility properly. All of these bed mobility motions require strength in different muscle groups. By doing proper examination along with different motions in bed mobility, the physiotherapist can drill down on specific muscle groups that may be weak or that may benefit from exercise to get the patient's bed mobility back to normal. Muscle groups that will be focused are quadriceps, hamstrings, gluteus muscles, calf muscles, shoulder and rotator cuff muscles, triceps and biceps, and arms. How can we start the bed mobility? First, figure out how much help the patient needs. Second, make sure that it could be provided safely and comfortably. Third, prior to assisting with bed mobility. Fourth, consider the following important checklist and safety tips. Important checklist and safety tips before bed mobility. First, clear the area and have needed equipment in your reach. Second, if there are any lines, tubes or catheter, ensure it would not interfere with the bed mobility activity. Third, decide which side of the bed the patient should get out from based on their strength, comfort, and ease of transferring. Fourth, position yourself to that side of the bed where the patient would roll toward you. Fifth, if the bed is adjustable, adjust the height to approximately to your hips level. Sixth, if the bed has rails, please lower the on mobility side. Seventh, inform the patient what to expect, involve the patient as much as possible. Give clear direction before and during activity. And the eighth one is, give clear directions. Sometimes counting 1, 2, 3 allows the caregiver and patient to work together. Patient safety tips during bed mobility. First, avoid forcing or pulling on the individual's extremities. Second, assist the patient on their weaker side. Third, minimize shearing forces on the skin. Fourth, if applicable, maintain all precautions set by the physician. Fifth and last one is, If you are ever unsure, get needed help. Important bed exercises to be practiced before doing bed mobility. Static quadriceps, static glutes, straight leg raise, hip abduction and adduction, hip and knee flexion, ankle dorsiflexion and plantar flexion, bridging, bent knee fallouts. Static quadriceps. Put the patient's legs out straight in the bed in front of him. Pull his foot up towards him and push his knee down into the bed. Remember to exercise both legs. 1 set of 5 repetitions. As a progression, place a roll under the knee and repeat the same. Static glutes. Keep patient legs out in front of him. Contract your bottom muscles, making sure he don't tense his leg or stomach muscles. 1 set of 5 repetitions. Straight leg raise. Bend one knee up so patient foot is on the bed. Straighten his other leg and lift off the bed a few inches. Then slowly relax the leg back down. Repeat it 5 times. Hip abduction and adduction. Put patient's legs out straight in front of him. Then slide his leg out to the side and back to the middle. Repeat it 5 times. Hip and knee flexion. Bend the patient's knee up in front of him, keeping it in midline to his body. Bend it up as much as he can. Then slowly lower back down to the bed. Repeat it 5 times. Ankle dorsiflexion and plantar flexion. Ask the patient to pull his foot up towards as much as he can. Then ask him to point his foot away from him. Repeat on the other leg also. 1 set of 5 repetitions in each leg. Bridging. Ask the patient to bend his knees up so his feet are flat on the bed. Using his bottom and leg muscles, raise the buttocks up off the bed, pushing equally through both legs. Keep the pelvis level. Slowly lower back to the bed and repeat 5 times. Bent knee fallouts. With the patient knees bent up on the bed, slowly lower one knee out to the side and bring it back to the middle. Make sure your other knee stays in the middle when lowering the opposite leg out to the side. Repeat it 5 times. Now we are going ahead with the steps to accomplish a safe bed mobility. The following steps are for getting out of bed. The leg closest to the edge of the bed can be straight or bent. Have the patient bend the opposite hip and knee. Place your hands behind the patient's shoulder and hip or thigh on the far side. Have the patient reach with their opposite arm across their body, toward the side of the bed. Important tip: the patient should always roll towards you, not away from you. Assist the patient in rolling toward you and have them use their opposite arm to reach across their body into a side-lying position. The patient should place their arms in a position that is comfortable for them. That allows the patient to use their arms and upper body strength to help push up to a seated position. The patient should now be lying on their side with hips and knees bent. Have the patient move their legs off the edge of the bed. If needed, you can assist the patient to move their legs from behind their knees. The patient can use both arms to push up to help achieve a sitting position. If needed, assist the patient to achieve a sitting position by placing one arm behind their shoulder. The other arm could be placed behind the other shoulder, supporting their trunk, as pictured, or on the patient's pelvis. Important tip: if assisting the patient, perform the activity in a continuous smooth motion. Always take your time, do not rush. Sitting to standing. To help the patient move from a sitting position on the bed to a standing position, first assist the patient to scoot to the edge of the bed. With you standing in front of the seated patient, the patient leans to one side while you support the shoulder on that same side. With your other arm, help the patient shift the hip forward. This process would be alternately repeated on the opposite side. Make sure the patient's feet are flat on the floor and she sits for a few seconds, or minutes, as needed, before leaning forward to be assisted to a standing position. If the patient is preparing for standing, have them lean forward, keeping both their hands flat on the bed or on their lap to assist with pushing off the bed during the transition from sit to stand. This video is showing bed mobility from supine lying to sitting. This video is showing bed mobility from sitting to standing. The steps to transition from sitting to supine lying are as follows. Have the patient sit on the bed and away from the edge, which allows for less repositioning once in bed. Assist the patient as needed to get into side lying position. Have the patient bend both knees and roll onto their back. Assist patient as needed. The patient can scoot in bed to adjust to a comfortable position. Assist patient as needed. This video is showing bed mobility from sitting to lying. Thank you for listening to this presentation.